Vitamin B12 deficiency is a serious health concern that often goes unnoticed, even by medical professionals. Importantly, the unsettling effects of low B12 can appear even when a blood test theoretically indicates normal levels. That might sound surprising, but that's the reality of the situation. It's one of the reasons why I believe current reference ranges for vitamin B12 can be insufficient. Because this topic is so important, I encourage you to read through the entire text. I'll explain which symptoms may indicate a B12 deficiency, who's most at risk, and how to effectively maintain proper levels of this vitamin in the body. Let's begin with the problem most commonly associated with vitamin B12 deficiency: anemia. Many people refer to low B12 when they actually mean this condition, more specifically megaloblastic anemia. Before I discuss the possible signs of this illness, I need to emphasize that a lack of vitamin B12 can wreak much greater havoc on the body than just issues with the blood-building system. In my view, a B12 shortage often has a bigger overall impact than, for example, an iron deficiency, which also leads to anemia but typically doesn't come with such widespread consequences. When it comes to the simplest manifestation of a B12 deficiency, anemia, it happens because insufficient vitamin B12 disrupts the formation of red blood cells. As a result, the body produces overly large and malformed red blood cells, known as megaloblasts, which also have a shortened lifespan and are less efficient at transporting oxygen. This triggers a chain reaction of unpleasant symptoms. Patients often complain of constant fatigue and pronounced weakness, which can be noticeable even during routine daily activities like cleaning or taking a short walk with the dog. Rest and sleep don't always bring full relief, and in some cases, shortness of breath occurs during exertion due to inadequate oxygenation of the body. Many people also notice pale skin with a distinctive yellowish tone, especially around the mouth near the neck and on the conjunctiva. An intriguing detail is that B12 deficiency may speed up the graying process of hair. Additionally, individuals with a B12 deficit can experience headaches, dizziness, and sometimes tachycardia in more advanced stages. Tachycardia is a faster than normal heartbeat that occurs when the body tries to compensate for inadequate oxygen in the bloodstream by making the heart beat more rapidly. Moreover, anemia caused by low vitamin B12 can lead to difficulty concentrating and staying focused. Some people report a feeling of mental cloudiness. There's also a noteworthy symptom often linked to insufficient B12, the so-called beefy tongue. It appears smooth and glossy. Occasionally it becomes painful and inflamed, with the papillae on its surface disappearing and causing a burning sensation. In rare instances, mouth ulcers and other inflammatory conditions can develop inside the oral cavity. However, the consequences of inadequate vitamin B12 intake don't end with anemia. It can also cause severe neurological problems that can become irreversible if left unchecked for too long. Why does this happen? Vitamin B12 plays a critical role in forming the myelin sheath, which protects nerve cells. When the body doesn't get enough B12, the nervous system begins to malfunction, leading to a wide range of concerning symptoms. Intriguingly, some patients experience neurological symptoms only, without any sign of anemia whatsoever. Characteristic signs of peripheral nerve damage include tingling, burning, or numbness in the limbs, and sometimes an odd prickling in the toes. In some people, this tingling may be the very first alarm bell for vitamin B12 deficiency. As the problem grows, other symptoms can worsen, such as reduced sensitivity in the arms and legs, or overall weakness. Some patients also encounter trouble with coordination or balance. A specific sign pointing toward B12 deficiency can be Lhermitte's sign, a sudden electric shock sensation along the spine when the head is tilted forward. Though relatively rare, it's worth being aware of. To make matters worse, B12-related nerve damage can manifest in other ways. Some individuals report urinary incontinence, erectile dysfunction, vision issues, or even partial hearing loss. Chronic low B12 can also diminish mental sharpness and lead to what's called secondary dementia. Thankfully, once the body's B12 levels are restored, there's a chance this decline can be reversed. Another neurological effect is orthostatic hypotension, where blood pressure drops suddenly upon standing up from a lying or seated position, often resulting in those stars that appear before your eyes. A lack of vitamin B12 can sometimes produce psychiatric symptoms, too: mood swings, anxiety, depression, hallucinations, or even psychotic features. Clearly, the impact of B12 deficiency is widespread. It's also important to remember that B12 is involved in the metabolism of homocysteine, an amino acid that begins to accumulate in the body when vitamin B12 is lacking. High homocysteine levels promote atherosclerosis, as they are atherogenic, and can encourage blood clots. Consequently, B12 deficiency may negatively affect the cardiovascular system as well. Who's especially prone to low B12? Primarily those with malabsorption disorders, for instance, patients with Crohn's disease, bacterial overgrowth in the small intestine, celiac disease, or an H. pylori infection. B12 deficiency also appears in individuals who have undergone partial removal of the stomach or small intestine. Naturally, problems with B12 can occur in Addison-Birmer anemia, sometimes referred to as pernicious anemia, where autoimmune processes damage the gastric parietal cells that produce intrinsic factor. Without intrinsic factor, even if you consume plenty of B12, it can't effectively enter the bloodstream. As we age, the risk of vitamin B12 deficiency grows, so it's frequently detected in seniors. This can be due to the reduced levels of stomach acid necessary to release B12 from food, as well as age-related atrophic gastritis. Additionally, some medications can negatively impact B12 metabolism. Common examples include proton pump inhibitors like omeprazole and H2 receptor antagonists such as ranitidine and famotidine, used for stomach ulcers or gastroesophageal reflux disease. It's also worth mentioning metformin, a frequently prescribed diabetes drug. Studies show that as many as 1/3 of patients on long-term metformin therapy may develop vitamin B12 deficiency. When it comes to diabetes management with metformin, the neurological side effects of a potential B12 deficiency, like tingling in the limbs, can easily be confused with diabetic neuropathy, which is nerve damage caused by the diabetes itself. If a doctor sees a patient on metformin who complains of tingling or numbness, they might attribute it to poorly controlled blood sugar rather than suspecting a side effect of the medication. Hence, if you've been on metformin for a while, it's wise to have your B12 levels checked periodically. It's also important to highlight that vegans are at particular risk for B12 deficiency, since dietary sources of this vitamin are found almost exclusively in animal products: red meat, poultry, fish, seafood, eggs, and dairy. Some people argue they don't need dietary B12 because gut bacteria can synthesize it, but unfortunately, most of that production happens in the large intestine, while B12 absorption takes place in the small intestine. So there's no way for the vitamin to travel back up the digestive tract. Chlorella does supply a small amount of B12, but the doses are generally negligible, and the vitamin itself is fragile. Spirulina mainly provides a pseudo-vitamin B12 that doesn't serve a useful physiological function in humans. There are plenty of other factors that can foster a B12 deficiency: overuse of alcohol, long-term oral contraceptive use, chronic pancreatitis, or certain parasitic infections. While we're on the subject, feel free to subscribe if you find my videos helpful. Clicking the button beneath this video and tapping the bell icon ensures you won't miss any future uploads. If you've noticed the symptoms described here, or if you're in a high-risk group, it's a good idea to check your B12 levels. However, there's some debate around existing reference ranges. Standard practice considers 200 to 1,300 picograms per milliliter as normal, but people at around 300 to 400 picograms per milliliter can still experience hidden deficiencies. Based on recent research, many experts believe you should aim for at least 400 picograms per milliliter, and ideally somewhere in the 800 to 900 picograms per milliliter range. It's also worth noting that measuring B12 in the bloodstream doesn't always reflect the vitamin's status in your tissues. So if your results hover around 300 to 400 picograms per milliliter, or lower, testing homocysteine might help clarify the picture, since its levels rise with a B12 deficiency. Though bear in mind that high homocysteine doesn't always mean B12 is the culprit. Additional tests, like checking holotranscobalamin, the active form of vitamin B12, can detect shortfalls relatively early. Another sensitive marker is methylmalonic acid, though it tends to be expensive. Naturally, in the case of megaloblastic anemia, a complete blood count can offer clues, specifically an elevated mean corpuscular volume, as well as lowered levels of white blood cells, platelets, or neutrophils. Reduced hemoglobin is another potential indicator. But remember, B12 deficiency doesn't always present with anemia, so a basic blood count can be misleading and is best viewed as a supplemental test. How can you replenish low B12 levels? First and foremost, focus on a well-balanced diet. For those who eat animal products, this should include items like beef or chicken liver, beef, poultry, fish such as trout, herring, and salmon, eggs, and dairy-based fermented foods like plain yogurt, kefir, or cheese. Plant-based foods generally don't have significant amounts of B12 because they can't synthesize the vitamin. While bacteria on these foods might produce trace amounts, B12 is unstable and easily degraded. I should also mention the official dietary recommendations for vitamin B12, 2.4 micrograms per day. However, many experts now suggest that might be too low, urging a target of around 6 to 10 micrograms. This reflects ongoing discussions about how we view B12. Moreover, recommended values are typically for healthy adults, and people with certain conditions may need more. If your B12 levels drop below 350 picograms per milliliter, it's generally a good idea to use supplements. A daily dose of around 500 to 1000 micrograms is often advised until levels normalize. Splitting the total into smaller portions can help increase absorption. Those who only need a little boost might go for 100 to 200 micrograms per day. Fortunately, there's practically no risk of overdosing on B12. As for which form is best, methylcobalamin or cyanocobalamin, there's not as much difference as some sources suggest, nor does it matter significantly whether you take a standard capsule or a sublingual tablet. In rare cases where oral supplements are ineffective, for instance, due to significant absorption problems, intramuscular injections of B12 can be considered. However, these injections can be painful and carry a small risk of anaphylaxis, so they shouldn't be administered on your own. If this material piqued your interest, I'd be grateful if you'd give it a like and leave a comment. Let me know which part you found most intriguing, or share your own experiences with B12. That's all for today. Thank you for your attention, and I hope you'll tune in for future episodes. Let's take care of our health and remember that maintaining proper levels of vitamin B12 can help prevent many serious complications. See you next time.